Hello and welcome for today's session. So today we are going to discuss about the radiopharmaceuticals. So let's start with the discussion. So first we are going to discuss some introductory part about the radiopharmaceuticals. So they are specially designed products that are used therapeutically for the treatment as well as the diagnosis, and their uses are very restricted and are primarily used for the diagnostic purpose. They can be administered by injection, orally, or inhalation. Radiopharmaceuticals, they get distributed in the body and emit radiations. So these radiations are photographed to detect internal injury in the body or abnormal cell growth, etc. And the radiation exposure kept very low. There are some ideal characteristics which radiopharmaceuticals possess. So, like radiopharmaceuticals have very short physical life. They eliminate from the body with a half-life that is almost equivalent to the duration of the test, preventing further exposure to the body. They quickly and broadly localize at the target site. They deteriorate into the more stable outer nucleus. They readily, efficiently adhere to the chemical component at the room temperature. Radioactive decay. So what is radioactive decay? We are going to see. So it is also known as nuclear decay, radioactivity, or radioactive disintegration, or nuclear disintegration, we can see. It is the process by which an unstable atomic nucleus loses energy by radiation. A material containing unstable nuclei is considered radioactive. Three of the most common types of decay, like alpha decay, beta decay, and gamma decay. So all of which involve emitting the more one or more particles. So let's discuss about these three radiations. So first alpha rays, so which could barely penetrate a piece of paper. So the penetration power becomes very low. And the beta rays, so which could penetrate 3 mm of aluminum sheet. If we take a aluminum sheet of 3 mm of width, then beta rays can easily pass, but alpha rays cannot. The gamma rays, which could penetrate several centimeters of lead. So here we can see the gamma rays possess more penetration power than the alpha rays and beta rays. So there is unit of measurement of radioactivity. So the old unit of radioactivity was Curie, named after the scientist Madame Curie, that is Madame Marie Curie and the Pierre Curie, and the pioneers who studied the phenomenon of radioactivity. 1 Curie is the number of disintegration emanating from the 1 gram of radium-226 and is equal to 3.7 into 1010 becquerel. So what is becquerel? In the international system, the unit of radioactivity is 1 nuclear transmutation per second and is expressed in becquerel, named after the scientist Henry Becquerel. So let's take an example of sodium iodide, which is also a radiopharmaceutical and possesses the radioactive properties. So synonym of sodium iodide is radioactive iodine. Out of all radioactive isotopes of iodine, iodine 131 is most commonly used. It is used as an aqueous solution of sodium iodide, having sodium thiosulfate in addition as a reducing agent. So there are some standards. So it should not contain less than 90% and not more than 110% of labeled amount of iodine 131 as iodine, which is expressed in the microcuries or millicuries at the time of indicating in the labeling. So there are some properties like it forms a colorless solutions when we dissolve in a particular solvent. Iodine 131 have half-life of 8.4 days and emits beta and gamma radiations as well. Its solution having pH range of 7 to 10, that it is basic in nature. So in treatment of hypothyroidism, we also use the iodine 131. So iodine inhibits the release of thyroid hormone and forms the basis for its use in the hyperthyroidism. All the isotopes of iodine are rapidly taken up by the thyroid follicles, and radioactive iodine, that is iodine 131, is available as sodium iodide 131 solution, and it is administered orally. And the absorption of iodine 131 leads to the highly localized destruction of thyroid follicles due to the beta particles emission. This property of iodine 131 has promoted radioactive iodine as a therapeutic alternative in surgical removal of the gland, and the radioactive iodine therapy is considered advantageous over surgery because of the simplicity of its procedure, its application to the patients, avoidance of surgical risk, and the complications. So sodium iodide 131 solution, it is available in the capsule. So it is suitable both for the oral as well as IV administration, and the solution is clear and colorless. But as the time passes, both the solution and glass may get darkened due to the effect of radiation. and the pH of solution varies between 7.5 to 9. That is, it is in the range of basic pH. And for injection, a suitable preservative such as benzyl alcohol is added. A reducing agent such as sodium thiosulfate is also added to the solution, and to prevent the oxidation of sodium iodide in aqueous solution. Potassium salt, iodide, and iodate have been acting as a carrier for the iodide ion and for the iodate ions present in the sodium iodide solution. Sodium iodide, that is iodine 131 capsule, are prepared by evaporating an alcoholic solution of the sodium radioiodide directly on the walls of the capsule or on inert capsule filling material. So next part is about the handling and storage of radioactive material. So first, great care must be taken in handling and storage of radioactive material so as to protect the people from its harmful effects. The radioactive material are stored in the remote areas such that it should be always away from the exposure to the human beings. Alpha and beta emitters are stored in thick glass such that shielding effect is provided, while gamma emitters are stored in the lead containers. And the area of radioactive material should be tested for intensity of radioactivity by using some devices which measures the radioactivity in a particular room or storage area. Exposure to the radioactive radiation can cause blood cancer to a person. Depends upon the radiation of that particular radioactive substance. A person who carelessly comes in the contact of that particular radioactive substance, then it may lead to the causing causative agent for the blood cancer, and lead shielding is required while handling with the radioactive substances. Shielding effect can also be achieved by water layer and concrete blocks. Water layer blocks only radiation which allows visible light to pass, while concrete blocks all the radiations. So here is the difference between the shielding layer of water as well as the concrete layer. Next part is about the storage of radioactive substances. So first, radioactive pharmaceuticals should be kept in well-closed container and stored in an area assigned for the purpose. The storage conditions should be such that the maximum radiation dose rate to which persons may be exposed is reduced to an acceptable level. Care should be taken to comply with the national regulations for protection against ionizing radiations. So here I want to add one thing, that why it is necessary to take some certain precautions while handling and the storage. As you have heard in the history during the world after the World War II, how the World War II ended. The United States, then they bombed the Japan on two cities, that is Hiroshima and Nagasaki. They dropped the atomic bomb, we say. The atomic bomb was containing uranium 235, which is a highly radioactive material. Okay, after the blast, the lot of peoples get died, and still after the explosion, after the end of World War II, still the people of Japan are facing the radiation problems. It carried throughout the generations. So it is very important to avoid the radiations of such radioactive materials. So that's why we need to take or we need to follow the rules and the instructions while the storage and handling of the radioactive materials. So radiopharmaceutical preparations that are intended for parenteral use should be kept in a glass vial, ampoule or syringe that is sufficiently transparent to permit the visual inspection of the contents. Glass containers may darken under the effect of radiation. So there are some precautions for handling of the radioactive substance. The following guidelines provide information on the safety handling of the radioactive substances. They are based on the relevant legislation and on the code of practice for handling of radioactive substances. The radioactive substances you should comply with the following characteristics. First, short-living isotopes are prepared to long-living ones, and the amount used must be kept to a minimum. And they never work alone in a radioactive lab, especially not outside the normal working hours. Always make sure to have someone nearby in case of emergency. Take all precautions to prevent radioactive contamination. Always separate radioactive activities from non-radioactive activities. As far as possible, limit the area where radioactive substances are used and mark the area, for example, by using the containers with absorbent paper. Apply a radiation symbol to any containers and items that have come into contact with radioactive substances. Never bring documents such as notes into the radioactive zone. When handling radioactive materials, always wear the appropriate protective clothing. Wear a lab coat if there is a risk of serious contamination. Wear disposable clothing. Store your lab coat away from your regular clothes. Always wear gloves when handling radioactive substances. Regularly check the radiation level of these gloves. Never touch anything with the potentially contaminated gloves. Use paper tissues instead. Wear shoe covers in room where the floor may be contaminated. Keep personal items such as handbags, etc., your purse, your wallets, etc., outside the lab. Use appropriate radiation shields. Return the stock solution to the storage immediately after removing the amount needed. To avoid internal contamination, strict hygiene is essential while handling the radioactive materials. Eating, smoking, drinking, and applying cosmetics are prohibited in the radioactive labs. Never pipette by mouth. Use pipette devices instead. So, where we are using the liquid radioactive materials, so we cannot use the regular pipettes which are used in the chemistry labs. Then wash your hands thoroughly. Then you leave the lab. Then regularly check the radiation level of your working area and all objects used, or at least at the end of each working day. Replace contaminated absorption paper, decontaminate contaminated objects, dispose of all radioactive waste in the appropriate containers, limit the amount of waste to a bare minimum, separate short living and long living radioactive waste. So next part is about the labeling of radioactive substance. The labeling becomes very important because mislabeling can lead to a disaster. So every radiopharmaceutical preparation must comply with the labeling requirements established under the Good Manufacturing Factories, that is GMP guidelines. The label on the primary container should include a statement that the product is radioactive or the international symbol of the radioactivity, the name of the radiopharmaceutical preparation, should be included on the label where the appropriate the preparation is for the diagnostic or for the therapeutic use or the prophylaxis use, so it should also be mentioned on the label, and the route of administration which is very necessary. Next necessary thing is the total radioactive present at a stated date and where necessary time. For solutions, a statement of radioactivity in a suitable volume, for example in millibecquerel per ml of the solution, may be given instead. And the expiry date and for the where it is necessary, then time should also mentioned, and the batch number assigned by the manufacturer. And for the solution, the total volume should be printed on the label. And the label on the outer package should include a statement that the product is radioactive or the international symbol for the radioactivity, or the name of the radiopharmaceutical preparation. Where appropriate, the preparation is for diagnostic or for therapeutic use. The route of administration should also be mentioned on the external label. The total radioactive present at the stated date, where necessary time for solutions, a statement of the radioactive in a suitable volume, for example millibecquerel per ml of the solution, may be given instead. The expiry date and if it is necessary, then time also mentioned. The batch number or lot number assigned by the manufacturer is also necessary. And for solution, the total volume of that particular solution should be also mentioned on the outer layer. Any special storage requirements with respect to the temperature or light, like you have to store it at a room temperature or low temperature, or it may be a -4 degree temperature, etc. Or sometimes it should be avoided the direct exposure to the light, or should be stored in an amber color bottle. So these guidelines should be mentioned on the outer layer. Where applicable, the name and concentration of any added microbial preservative, or where necessary, that no antimicrobial preservative has been added. So there are some pharmaceutical applications of radioactive substances. So let's see some examples. So for the treatment of cancer and tumors, the americium 241 is used as an antineoplastic agent, californium 252 as used as an antineoplastic agent, cobalt 60 also used as an antineoplastic agent, and gold 94 is also used as an antineoplastic agent. Now, holmium 66 being developed for diagnosis and treatment of liver tumors. So the research work is going on holmium 66. Iodine 125 used in cancer brachytherapy, that is prostate and brain cancer. So treatment of thyroid disease with iodine 131. So iodine 131 is therapeutically used for the to treat thyroid cancer, hyperthyroidism, including the grave disease, toxic multimodular goiter, and toxic autonomously functioning thyroid nodules, and non-toxic multinodular goiter. So in treatment of arthritis, erbium 169 it is used, and the use of relieving arthritis pain in synovial joints. Diagnostic radiopharmaceuticals. So erbium 169 is used in treatment of pain in the synovial joints. So ammonia N13 injection used for the diagnostic of coronary artery disease. In chromium 51, it is used for the diagnostic of pernicious anemia. Holmium 166 used for the diagnosis and treatment of liver tumors. Iodine 125 used for the diagnostic and evaluation of the filtration rate of kidneys. That is, if you want to check the glomerular filtration rate, then we can use the iodine 125. Thank you. This is about the radiopharmaceuticals.